I used to play soccer and run around and cook and do everything and anything possible.
Jana was a very healthy, amazingly energetic young lady. Your typical 5th grader at the time, suddenly violently ill, couldn't keep any food down, could no longer put even a sip of water into her mouth.
I lost 20 pounds in 5 weeks, and then I had to go to the ER, and they told me that I would have to have a feeding tube. The name of my condition is gastroparesis, and it's also called delayed gastric emptying. It's when one or more of your stomach muscles don't work, and it basically causes all the food to just stay in your stomach, so none of it processes the right way in your stomach.
She's on formula feeds through her G-tube. We do anywhere from 2 to 3 feeds, which equal to about 16 to 20 hours a day on the feeding pump.
A lot of these kids feel very isolated and lonely, and they feel different than their other kids and other family members. So that weighs really heavily on a child, but it also weighs very heavily on the family who has to deal with that and seeing their family member go through that. It's very painful for the family as well.
Our world was completely turned upside down.
Palliative care is about creating a better quality of life for the child, helping to relieve some of the stress of that chronic and severe illness, helping that family cope. So that really could be a lifelong journey for this patient.
We as the palliative care team will be the constant in their lives when they come into the hospital.
Our team of doctors has been amazing in helping us through that journey.
Children are not mini adults, and people used to perceive that for a long time that, oh, we can treat them just like we treat the adults, and it's completely different.
One of the programs we're most proud of is our Child Life Specialist program. We have a team of phenomenal people who are experts in understanding the specific developmental stages of children.
We use a lot of play therapy with them, where you can kind of mimic, maybe on a doll, what would be happening to you.
When I first did get diagnosed and when I first was in the hospital, I didn't understand it as much as I do now, and they really helped me to understand what it is.
We have Matt the Music Man. Our chronic kids come in, and that's one of the first things they ask for.
He really just helps to make the day brighter. He usually comes on Wednesdays and Fridays, so when I'm in, I'm like, yay, today's Wednesday, Matt Cook's gonna be here. So at least I have something to look forward to in the day. They want to make the best of your life. Even though you're not feeling well and you're feeling sick, to make you happy and to make you not forget about it completely, because you can't forget about it if you're not feeling well, but to kind of take your mind off things.
The Child Life program is 100% funded by donor support, and we continue to grow that program as we see the need. I can't imagine our hospital without that program. It is embedded in everything that we do. Child Life is also a very big part of our new Pediatric Palliative Care Program, also made possible through very generous donor support. We want to be proactive and really anticipate the needs of all of our families, and donor support helps us do that.
So Jana, since she has gotten her mini one-button G-tube, she is managing quite well at home for the most part. We try to manage everything at home as long as she's able to tolerate the feeds. We can only do that because of the care that the doctors give us, because if there's something wrong, we know we can go in and they'll tell me if we need to go into the hospital for dehydration or if we can continue to manage it at home.
Now here I am, and I'm doing good, and I'm managing everything, and it's really not as bad as I thought it would be when I was first in the hospital.
We're honored to be able to do what we do, but we couldn't do it without the help of the donors.
When the foundation representatives told us that we had people donating to us, I was amazed, and it actually brought a tear to my eye, knowing that there are people out there supporting us in such a way without even thinking about it. It's just wonderful.
It is something that inspires me every single day. So the kindness and generosity of complete strangers, the hospital, the staff, they have all gone above and beyond to support our family, and it gives us all hope that it doesn't have to be all bad.
I didn't know how strong I was. Like, I never could have thought that I would be this strong.